Hi everyone, welcome to PharmaGrid. So today we are going to start with the human anatomy and physiology. So first we will see the urinary system. So here I am going to mainly cover the basic portions regarding the urinary system. Okay, so let's start. Urinary system organs. The urinary system consists of two kidneys, that is a pair of kidneys, two ureters, one urinary bladder and one urethra. Okay, so these are the major organs coming under the urinary system, that is a pair of kidneys, a pair of ureters, one urinary bladder and one urethra. So we know that kidneys are a major excretory organ. So after the kidneys filter blood plasma, they return most of the water and solutes to the bloodstream. The remaining water and the solutes constitutes urine. So urine is the excretory product. It's formed in the kidney, mainly the nephron. It passes through the ureters and it is stored in the urinary bladder until it is excreted from the body through the urethra. So this is in a nutshell. We can say that what is the important function of our urinary system. So the excretory product, that is the urine, which is formed within the kidney, it passes through the ureters and it is temporarily stored in the urinary bladder until it is excreted through the urethra. Nephrology. Nephrology means neph means kidney, ology means study of. So nephrology is the scientific study of the anatomy, physiology and pathology of the kidneys. The branch of medicine that deals with the male and female urinary systems and the male reproductive system is called urology. Moving on to the functions of the urinary system. We'll start with kidneys. So the kidneys regulate the blood volume and composition by regulating the blood levels of several ions such as sodium, potassium, calcium, chloride and phosphate ions. Then how they regulate the blood volume? The kidneys adjust the blood volume by conserving or eliminating water in the urine. So increase in blood volume will lead to increase in the blood pressure, and if there is a decrease in blood volume, that will lead to decrease in blood pressure. And the next function is the kidneys help regulate the blood pressure. And in one more way, the kidneys helps regulate the blood pressure by secreting the enzyme renin. So the renin, the function is that it activates the renin angiotensin aldosterone pathway. So if there is an increase in renin, that will lead to increased blood pressure. So this is how the kidneys regulate the blood pressure. Next function is regulating the blood pH. Kidneys excrete a variable amount of H plus ions into urine and conserve bicarbonate ions, so which are an important buffer for H plus ions in the blood. So both of these activities help regulate the blood pH. And the next function is the regulation of blood glucose. Like liver, kidneys can use amino acid glutamine in gluconeogenesis. Gluconeogenesis is nothing but the synthesis of new glucose molecules. And the next major function or most important function is the excretion of waste. So by forming urine, the kidneys helps excrete waste. So some waste excreted in urine result from metabolic reactions in the body. For example, ammonia and urea. They are formed from deamination of amino acids. Then bilirubin from catabolism of hemoglobin. Then creatinine. It is formed from breakdown of creatine phosphate in the muscle fibers. Then uric acid. It is mainly formed due to catabolism of nucleic acid. And the next important function is the kidneys produce two hormones, that is the calcitriol and erythropoietin. So calcitriol is the active form of vitamin D. It helps regulate the calcium homeostasis. And erythropoietin, it helps stimulates the production of red blood cells. Okay, so we have done with the functions of kidneys. Next one, ureters. Okay, ureters, we already know. These ureters transport urine from kidneys to the urinary bladder, and then the urinary bladder stores the urine and expels it into urethra. Then at last the urethra, it discharges urine from the body. Okay, so these all are the functions of the urinary system. Now we will see the structure of kidney. So the kidneys are reddish. Okay, here you can see reddish kidney bean shaped organs located just above the waist between the peritoneum and the posterior wall of the abdomen. Because of their position, okay, their position is posterior to the peritoneum of the abdominal cavity. These organs, that the kidneys, are said to be retroperitoneal. Then the kidneys are located between the levels of the last thoracic and third lumbar vertebrae, a position where they are partially protected by the ribs 11 and 12. That is why if these lower ribs are fractured, they can puncture the kidneys and can cause significant, even life-threatening damage. Then the right kidney, okay, here you can see the right kidney is slightly lower than the left because the liver occupies considerable space on the right side superior to the kidney. Okay, this is the reason why the right kidney is slightly lower than the left because the liver occupies considerable space on the right side. Then the three layers of tissues around each kidney, that is each kidney is surrounded by three layers of tissues, that is the renal capsule which is a deep layer, adipose capsule which is a middle layer, and renal fascia which is the superficial layer. Now we'll see the internal anatomy of the kidneys. So a frontal section through the kidney reveals two distinct regions, that is the renal cortex and the renal medulla, which are the two most important portions of the kidney. So the outer portion is the renal cortex and the inner portion is the renal medulla. So a superficial light red region is called the renal cortex and a deep darker reddish brown inner region called the renal medulla. Okay, so the two major portions of the kidneys we have noted, that is the renal cortex, which is the outer portion, and renal medulla, which is the inner portion. Then the renal medulla consists of several cone-shaped structures. They are known as renal pyramids. The base, that is the wider end of each pyramid, faces the renal cortex and its apex. Apex means the narrower end. It is known as the renal papillae. This renal papillae points towards the renal hilum. The renal cortex is a smooth textured area extending from the renal capsule to the bases of the renal pyramids and into the spaces between them. It is divided into an outer cortical zone and an inner juxtamedullary zone. The portions of the renal cortex that extend between the renal pyramids. So there is certain space between each renal pyramids. So the portions of the renal cortex that extend between the renal pyramids are called renal columns. So together the renal cortex and renal pyramids of the renal medulla constitute the parenchyma or functional portion of the kidney. So within the parenchyma are the functional units of the kidney. They are known as nephrons. Okay, so the functional unit of kidney is nephrons and each kidney constitutes about 1 million microscopic structures called nephrons. So this we will see in detail once we explain the structure. Okay, so then it will be more easy. Filtrate, that is a filtered fluid formed by the nephrons, drains into large papillary ducts which extends through the renal papillae of the pyramids. The papillary ducts drain into cup-like structures called minor and major calyces. Each kidney has 8 to 18 minor calyces and 2 or 3 major calyces. A minor calyx receives urine from the papillary ducts of one renal papillae and delivers it to a major calyx. So once the filtrate enters the calyces, it becomes urine because no further reabsorption can occur. Okay, so in simply we can say that the filtrate is formed within the nephron. Nephron is the functional unit of the kidney, and from the nephron the filtrate gets drains into large papillary ducts, and from the large papillary ducts this filtrate get entered into cup-like structures called the minor and major calyces. So once this filtrate enters the calyces, it will becomes urine. It becomes urine because no further reabsorption can occur. Now from the major calyces, the urine drains into single large cavity. Okay, this single large cavity called the renal pelvis, and from the renal pelvis the urine enters into the ureter, then to the urinary bladder where the urine is temporarily gets stored. The hilum expands into a cavity within the kidney called the renal sinus, which contains part of the renal pelvis, the calyces and branches of the renal blood vessels and nerves. Adipose tissue helps stabilize the position of these structures in the renal sinus. Here you can see the anterior view of dissection of the right kidney. So here we will see the major parts of the kidney. So the first and foremost, renal cortex, which is the outer portion of the kidney. See, here is the renal cortex, that is the outer portion of the kidney. Then the renal medulla, which is the inner portion. Okay, inner portion is known as the renal medulla, and the inner portion, that is this renal medulla, consists of certain cone-shaped structures. Here you can see the cone-shaped structures. They are known as the renal pyramids. Okay, so see this cone-shaped structures of the inside the or within the renal medulla is known as renal pyramid. Then the base of each pyramid. Okay, so this is the renal pyramids, and the base of each pyramid faces the renal cortex and its apex is known as the renal papillae. Okay, so the base of this renal pyramids are known as renal papillae. And here you can see certain spaces in between this renal pyramids. Okay, this is known as renal columns. That is the portions of renal cortex that extends between the renal pyramids is known as renal columns. Okay, so we have seen the renal cortex, which is the outer portion, renal medulla, which is known as the inner portion, and the renal medulla consists of certain cone-shaped structures known as renal pyramids, and the base of this renal pyramids is known as renal papillae, and the space between the renal pyramids is known as a renal column. Okay, renal column. Then this renal hilum. What is this hilum? The near the center of the concave border is an indention called renal hilum, through which the ureter emerges from the kidney along with blood vessels, lymphatic vessels and nerves. So here you can see this is the renal hilum. Okay, renal hilum. Now this is the nephron. Nephron is the functional unit of kidney, and here you can see the end portion of the nephron is the collecting duct, which extends to the papillary duct, and from there to the minor calyx, then to the major calyx, and then to the renal pelvis, then ureter and urinary bladder. Okay, so here you can see the path of urine drainage. The filtrate is formed within the nephron, and from there it drains into the collecting duct, then to the papillary duct, then to the minor calyx, major calyx, then to the renal pelvis, and from there it get entered into the ureter, and from the ureter it will get entered into the urinary bladder where the urine is temporarily stored, and from there it is expelled through the urethra. And here you can see the renal artery and the renal vein, which are the major blood vessels that supply blood to the kidney. That is renal artery that supplies the oxygenated blood, and the renal vein that carries away the deoxygenated blood. Okay, so these are the important portions, that is cortex, outer layer, medulla, inner portion, hilum, that is the depression which blood vessels and nerves pass. Pyramids. Pyramids are the divisions of the medulla. So here you can see the renal papillae, then calyx. Okay, calyx, that is a major and minor calyxes. Then pelvis, which is the renal pelvis. Then nephron, which is a functional unit of kidney. Then a renal sinus. Renal sinus means it is a cavity in the kidney which has renal pelvis, blood vessels, nerves and fat. So these are the important structures of the kidney. Blood and nerve supply of the kidneys. Because the kidneys remove waste from the blood and regulate its volume and ionic composition, it is not surprising that they are abundantly supplied with blood vessels. Although the kidneys constitute less than 0.5% of the total body mass, they receive 20 to 25% of the resting cardiac output via the right and left renal arteries. In adults, renal blood flow, the blood flow through both kidneys is about 1200 ml per minute. So here you can see the path of blood flow in kidneys. That is the renal artery, then to the segmental arteries, interlobar arteries, arcuate arteries, cortical radiate arteries, efferent arterioles, then to the glomerular capillaries, then to the efferent arterioles, peritubular capillaries, cortical radiate veins, arcuate veins, interlobar veins, then to the renal vein. So this renal vein carries the deoxygenated blood back to the heart. Now we'll see in detail the structure of nephron. Nephrons are the functional units of kidneys. Each nephron consists of two parts, a renal corpuscle and a renal tubule. A renal corpuscle is a place where, or the portion where, the blood plasma is filtered, and renal tubule is a tubule into which the filtered fluid, it is also known as the glomerular filtrate, passes. The two components of a renal corpuscle are the glomerulus. Glomerulus is nothing but the capillary network, and the glomerular capsule or Bowman's capsule, which is a double-walled epithelial cup that surrounds the glomerular capillaries. Blood plasma is filtered in the glomerular capsule, and then the filtered fluid passes into the renal tubule. The renal tubule consists of three parts, that is the proximal convoluted tubule, that is PCT, nephron loop or loop of Henle, and distal convoluted tubule, that is DCT. So this is the structure of a nephron. The nephron consists of two important parts, that is the renal corpuscle where the blood plasma is filtered, and the renal tubule. It is a tubule through which the filtered fluid passes. Then the renal corpuscle consists of two important components, that is the glomerulus. Glomerulus is the capillary network, and the glomerular capsule or the Bowman's capsule, which is a double-walled epithelial cup-like structure that surrounds the glomerular capillaries. Next comes the renal tubule. It is the tubule through which the glomerular filtrate or the filtered fluid passes through. So this renal tubule consists of three important parts, that is PCT, that is proximal convoluted tubule, then the loop of Henle. Loop of Henle, that is or nephron loop. It consists of again two portions, that is the descending limb of nephron loop and the ascending limb of nephron loop, then the distal convoluted tubule. Okay, so this is in a nutshell we can say that this is the structure of nephron, mainly the two parts, renal corpuscle and the renal tubule. Renal corpuscle consists of glomerulus and the glomerular capsule. Glomerular capsule is also known as Bowman's capsule. Then the renal tubule consists of PCT, proximal convoluted tubule, loop of Henle and distal convoluted tubule. So here again the components of a nephron are explained in detail. So this is the enlarged diagram of the renal corpuscle, which consists of glomerulus and the Bowman's capsule or glomerular capsule. So here you can see the efferent arterioles that carry blood from the heart, that is the oxygenated blood, and here you can see the efferent arterioles, okay, that carry blood to the heart, mainly the deoxygenated blood. And this is the Bowman's capsule, that is a cup-like double walled structure, and this is the glomerulus, that is a capillary network, and here you can see the starting portion of the proximal tubule. Again here the same is explained here. This is the glomerulus, that is a capillary network. Here you can see the efferent arterioles, that is from the systemic circulation, that is carry blood from the systemic circulation. Then efferent arterioles carry blood to the systemic circulation, and here you can see the proximal convoluted tubule, then the descending limb of loop of Henle, ascending limb of loop of Henle, then the distal convoluted tubule, then the collecting duct. Okay, so these are the major components of the nephron. Nephron is the functional unit of kidney. The nephrons can be categorized mainly into two types, that is the cortical nephrons and juxtamedullary nephrons. Cortical nephrons constitute about 80 to 85% of the nephrons. Their renal corpuscles lie in the outer portion of the renal cortex, and they have short nephron loops that lie mainly in the cortex and penetrate only into the outer region of the renal medulla. Then comes to the juxtamedullary nephrons, which constitute about a small portion, that is 15 to 20% of the nephrons. The difference is that their renal corpuscles lie deep in the cortex, close to the medulla, and they have long nephron loops. Okay, so we have seen in the cortical nephrons they have short nephron loops, whereas this juxtamedullary nephrons have long nephron loops that extends into the deepest region of the medulla. In addition, the ascending limb of the nephron loop of juxtamedullary nephrons consists of two portions, a thin ascending limb followed by a thick ascending limb. Nephrons with long nephron loops enable the kidneys to excrete very dilute or very concentrated urine. The distal convoluted tubules of several nephrons empty into a single collecting duct. The collecting ducts then unite and converge into several hundred large papillary ducts which drains into the minor calyces. We have already learned this. The collecting ducts and papillary ducts extend from the renal cortex to the renal medulla, then to the renal pelvis. And from the renal pelvis, urine first drains into the ureters and then into the urinary bladder. Urine is then discharged from the body through the single urethra. So, one kidney has about 1 million nephrons, but a much smaller number of collecting ducts and even fewer papillary ducts. So far we have discussed about the renal anatomy. Now we will move on to the physiology. So the renal physiology mainly involves three important portions or three important points, that is glomerular filtration, tubular reabsorption and tubular secretion. So the glomerular filtration occurs in the renal corpuscle, tubular reabsorption and tubular secretion occur all along the renal tubule and the collecting duct. So the rate of urinary excretion of any solute is equal to its rate of glomerular filtration plus its rate of secretion minus its rate of reabsorption. That is, net renal excretion is equal to glomerular filtration plus tubular secretion minus tubular reabsorption. So again, this is the structure of a nephron. Here you can see the renal corpuscle and the renal tubule and the collecting duct. So here you can see the glomerulus and the glomerular capsule. Glomerulus, mainly the capillary network, and here you can see the efferent arteriole that carries the oxygenated blood, and here the efferent arterioles. So this efferent arterioles continue as peritubular capillaries parallel to the PCT. So the first process occurs is the glomerular filtration, mainly occurs in the glomerulus. So in the glomerulus, blood plasma and dissolved substances smaller than most proteins get filtered into the glomerular capsule. See the arrow here. So the first process occurring is the glomerular filtration. So here the glomerular filtrate it passes through the renal tubule. And the next step is tubular reabsorption. Reabsorption means reabsorbed back into the blood. Okay, from the glomerular filtrate, what are the components needed that will get reabsorbed back into the blood. So that is tubular reabsorption. So all along the renal tubule and collecting duct, water, ions and other substances get reabsorbed from the renal tubule. See the arrow. Okay, from the renal tubule lumen into the peritubular capillaries. So these are the peritubular capillaries and ultimately into the blood. Okay, so this is what is happening in the renal tubular reabsorption. Next step is tubular secretion. Secretion means from the blood into the urine or into the lumen. So all along the renal tubule and the collecting duct, substances such as waste, drugs and excess ions get secreted from the peritubular capillaries into the renal tubule. Okay, so here the arrow, see the arrow, from the peritubular capillaries into the renal tubule. So these substances ultimately make their way into the urine. Okay, at last the urine will be formed which contains the secreted substances, that is the mainly the waste products. Then the blood contains the reabsorbed substances. Reabsorbed. What are the substances that will be reabsorbed? That is required for our body. Okay. And whatever not necessary for our body will be excreted. Okay. So this is about the renal physiology. Mainly the glomerular filtration, tubular reabsorption and tubular secretion. So in detail we will learn in the pharmacology chapters. Now we'll see about the glomerular filtration rate. It is the amount of filtrate formed in all renal corpuscles of both kidneys each minute is the glomerular filtration rate, which is denoted as GFR. In adults, the GFR averages 125 ml per minute in males and 105 ml per minute in females. Homeostasis of body fluids requires that the kidneys maintain a relatively constant GFR. If the GFR is too high, needed substances may pass so quickly through the renal tubules that some are not reabsorbed and are lost in the urine. If the GFR is too low means nearly all the filtrate may be reabsorbed and certain waste products may not be adequately excreted. Two hormones contribute to the regulation of glomerular filtration rate, that is angiotensin 2 and atrial natriuretic peptide, which is denoted as ANP. So this angiotensin 2 is a potent vasoconstrictor that narrows both efferent and efferent arterioles and reduces the renal blood flow, thereby reducing the glomerular filtration rate. So this angiotensin 2 reduces the GFR, whereas the atrial natriuretic peptide increases the GFR. So cells in the atria of the heart secrete atrial natriuretic peptide. So stretching of the heart as occurs when blood volume increases stimulates the secretion of atrial natriuretic peptide. So this ANP increases the capillary surface area available for filtration. So as surface area increases, glomerular filtration rate increases. So the glomerular filtration is controlled mainly by two hormones, that is angiotensin 2 and ANP. So angiotensin 2 reduces the GFR, whereas this atrial natriuretic peptide, that is ANP, increases the GFR. So in this slide you can see the substances filtered, reabsorbed and secreted per day. So what all are the substances? Mainly water, proteins, sodium, chloride, bicarbonate, glucose, urea, potassium ions, uric acid and creatinine. And what all are the amounts filtered? Filtered means that enters the glomerular capsule, and how much amount is reabsorbed, that is returned to the blood, and how much amount is secreted. Secreted means that is secreted back to the lumen to become urine. Five hormones affect the extent of sodium, chloride, calcium and water reabsorption as well as potassium secretion by the renal tubules. These hormones include angiotensin 2, aldosterone, antidiuretic hormone, that is ADH or vasopressin, atrial natriuretic peptide and parathyroid hormone. Parathyroid hormone is mainly secreted by the parathyroid gland. Now we'll see about urine. So urine is a liquid waste material produced and excreted by the body. It is secreted by the renal tubules. It accumulates in the urinary bladder and it is excreted via the urethra. Water accounts for about 95% of the total volume of urine. The remaining 5% consists of electrolytes, solutes derived from cellular metabolism and exogenous substances such as drugs. Normal urine is virtually protein free. So here you can see the characteristics of normal urine. Volume 1 to 2 liters in 24 hours. It can vary considerably. Then regarding the color, usually yellow or amber, varies with urine concentration and diet. Then the color of the urine is mainly due to the urochrome. Urochrome is a pigment produced from breakdown of bile and urobilin from the breakdown of hemoglobin. Then concentrated urine is darker in color. The color can be affected by a diet. For example, reddish from beets, then medications and certain diseases. Kidney stones may produce blood in the urine. Then turbidity. Usually transparent when freshly voided, becomes turbid. Turbid means cloudy on standing. Then odor, mildly aromatic, becomes ammonia-like on standing. Some people inherit ability to form methyl mercaptan from digested asparagus, which gives characteristic odor. Urine of diabetics has fruity odor due to the presence of ketone bodies. Then coming to the pH, ranges between 4.6 and 8. Average is 6, varies considerably with diet. High protein diets increase acidity. Vegetarian diets increase alkalinity. Then regarding the specific gravity or density, specific gravity is a ratio of weight of volume of substances to weight of equal volume of distilled water. In urine, the specific gravity is about 1.0012 to 1.035. The higher the concentration of solutes, the higher the specific gravity. Moving on to the next organ in the urinary system, which is the ureters. Okay, so here you can see the ureters. So this ureters transports urine from the renal pelvis of one kidney to the urinary bladder. Okay, that carries urine from kidney to the urinary bladder. So this is the main function of ureter. The ureters are 25 to 30 centimeter long and are thick-walled, narrow tubes that vary in diameter from 1 millimeter to 10 millimeter along their course between the renal pelvis and the urinary bladder. Like the kidneys, the ureters are retroperitoneal. As the urinary bladder fills with urine, pressure within it compresses the oblique openings into the ureters and prevents the backflow of urine. So this is how the backflow of urine is prevented. When this physiological valve is not operating properly, it is possible for microbes to travel up the ureters from the urinary bladder to infect one or both kidneys. Now we will see about the urinary bladder. So the urinary bladder is a hollow, distensible muscular organ situated in the pelvic cavity posterior to the pubic symphysis. In males, it is directly anterior to the rectum. In females, it is anterior to the vagina and inferior to the uterus. Urine is stored in the urinary bladder before being expelled by micturition. When the bladder is empty, numerous folds appear within and is known as rugae. The triangular area formed by the three openings in the floor of the urinary bladder, that is, two openings from the ureters and the internal opening of the urethra, is called trigone of bladder. This area is important as this is the most vulnerable area in case of abnormal growths occurring within the bladder. So here you can see the anterior view of the frontal section of the urinary bladder. So when empty, the urinary bladder looks like a deflated balloon. As it fills, it becomes round and then pear-shaped. The bladder holds an average of 700 to 800 ml of urine. And here you can see the ureters that transport urine from kidneys to the urinary bladder. And these are the urethral openings. Okay, so here I have mentioned about rugae. So here you can see the folds like structures. Okay, folds. So this is known as the rugae. The function of rugae is to allow expansion of the urinary bladder as it fills. Okay, so when the bladder is empty, so many numerous folds like structures appear inside the urinary bladder that helps to expand the urinary bladder when it fills. This is known as rugae. This fold like structures are known as rugae. And here you can see the triangular area which is known as trigone, where the three openings, where you can see the three openings. What are the three openings? That is two openings from the ureters and one from the internal opening of the urethra. Okay. Then the detrusal muscle. Detrusal muscle helps in the contraction to push urine into the urethra. Then here you can see the internal urethral orifice, that is the opening, and this is the internal urethral sphincter. This sphincter involuntarily controls opening and closing of the urethra. Okay, this is the internal urethral sphincter involuntary controls the opening and closing of the urethra. And here you can see the external urethral sphincter in deep muscles of the perineum. The function of this external urethral sphincter is to voluntarily controls the opening and closing of the urethra. And here is the urethra, the passageway for discharging urine from the body. And here you can see the external urethral orifice, which is the opening of urethra to the outside. So this is all about the urinary bladder. The main function is to hold the urine. Okay, transporting the urine that transports through the ureter and it get temporarily stored within the urinary bladder. Now the last portion of the urinary system, which is the urethra. It is a small tube leading from the internal urethral orifice in the floor of the urinary bladder to the exterior of the body. In both males and females, the urethra is a terminal portion of the urinary system and the passageway for discharging urine from the body. In males, it discharges semen. Semen means fluid that contains the sperm as well. The male urethra first passes through the prostate, then through the deep muscles of the perineum, and finally through the penis, a distance of about 20 centimeters, that is 8 inches. In females, the urethra lies directly posterior to the pubic symphysis and has a length of 4 centimeters, that is only 1.5 inches. The opening of the urethra to the exterior, that is the external urethral orifice, is located between the clitoris and the vaginal opening. That is, the urethra in females is really short compared to the males. So as the length of the urethra is less in females, females are more frequently affected with urinary tract infections. Now we will see some lab parameters that helps to diagnose some disease conditions related to the urinary system. So an analysis of the volume and physical, chemical and microscopic properties of the urine called as the urine analysis. So here we are mainly examining the urine, the physical, microscopic and the chemical characteristics, that is the color, transparency, presence of any cast, crystals, pus, erythrocytes, squamous epithelial cells, yeast, then the pH, presence of albumin, sugar, all these things are usually examined in urine analysis. In this slide, you can see some of the abnormal constituents in urine. So albumin. So it is a normal constituent of plasma, usually appears in only very small amounts in the urine because of its large size, it cannot easily pass through the capillary fenestrations. So the presence of excessive albumin in urine is known as albuminuria. And the next component is glucose. Presence of glucose in the urine is known as glucoseuria. It usually indicates diabetes mellitus and also occasionally caused by stress, which can cause excessive epinephrine secretion. Epinephrine stimulates the breakdown of glycogen and liberation of glucose from liver. Now, red blood cells, or otherwise known as erythrocytes. Presence of red blood cells in urine is known as hematuria. It generally indicates pathological condition. One cause is acute inflammation of urinary organs due to disease or irritation from kidney stones. Then other causes include tumors, trauma, then kidney disease, contamination of sample by menstrual blood, etc. Then ketone bodies. High levels of ketone bodies in the urine is known as ketonuria. It may indicate diabetes mellitus, anorexia, starvation, or too little carbohydrate in diet. Then bilirubin. When red blood cells are destroyed by macrophages, the globin portion of hemoglobin is split off and heme is converted to biliverdin. Most biliverdin is converted to bilirubin, which gives bile its major pigmentation. Above normal level of bilirubin in urine is called bilirubinuria. Then the next component is urobilinogen. The presence of urobilinogen is formed as a result of, it is a breakdown product of hemoglobin. The presence of urobilinogen in urine is called urobilinogenuria. So trace amounts are normal, but elevated urobilinogen may be due to hemolytic or pernicious anemia, infectious hepatitis, biliary obstruction, jaundice, cirrhosis, CHF or infectious mononucleosis. Then casts. Casts are tiny masses of material that have hardened and assumed shape of lumen of tubule in which they formed, from which they are flushed when filtrate builds up behind them. Casts are named after cells or substances that compose them or based on the appearance. For example, white blood cells, red blood cell cast, that is WBC cast, RBC cast, and epithelial cell cast that contain cells from walls of the tubules. Then microbes. Number and type of bacteria vary with specific urinary tract infections. One of the most common is Escherichia coli. Most common fungus is yeast, which is Candida albicans of vaginitis. Then most frequent protozoan is Trichomonas vaginalis, cause of vaginitis in females and urethritis in males. So these all are the abnormal constituents in urine. Presence of this indicates some pathological conditions. So here I have mentioned some of the laboratory tests as well as diagnostic procedures related to urinary system. So under laboratory tests mainly include BUN, that is blood urea nitrogen, and creatinine clearance test. So blood urea nitrogen usually measures the blood nitrogen, that is part of the urea, resulting from catabolism and deamination of amino acids. So elevated level of BUN is indicative of renal disease. Then creatinine clearance test. This test usually measures the plasma creatinine, which results from catabolism of creatine phosphate in the skeletal muscle. Normally, blood creatinine level remains steady. A creatinine level above 1.5 mg per deciliter indicates poor renal function. Then here you can see some of the radiological procedures such as X-rays, then KUB, CT scans, intravenous pyelogram, renal angiography, retrograde pyelogram, voiding cystourethrogram, ultrasonography, radioactive studies and MRI. So intravenous pyelogram, or it's denoted as IVP, it is a radiograph or it's a kind of X-ray of the kidneys, ureters and urinary bladder after venous injection of a radio-opaque contrast medium. Then a KUB scan, that is kidney, ureter and bladder. Ultrasound is an examination to evaluate the urinary tract, which includes the kidneys, ureters and urinary bladder. In the male patient, the prostate gland is also scanned. Then retrograde pylography, it is also a form of X-ray used to get detailed pictures of the upper urinary tract, including the ureters and kidneys. Uses a special dye injected into the ureters through a small catheter that is inserted during cystoscopy. The dye makes the ureters and kidneys more easily seen on the X-ray. Then renal angiography is an imaging test used to study the blood vessels in our kidneys. VCUG, that is voiding cystourethropy, also known as micturating cystourethropy, is a fluoroscopic study of the lower urinary tract in which contrast is introduced into the bladder via a catheter. The purpose of the examination is to assess the bladder, urethra, post-operative anatomy and micturition in order to determine the presence or absence of bladder and urethral abnormalities including vesicoureteric reflex. And this diagnostic procedure is more commonly performed in the pediatric population than the adults. And in this slide, I have included some of the common pathology conditions related to the urinary system. So urinary incontinence, which means loss of bladder control or inability to control urination. Enuresis, also known as bedwetting or involuntary urination. Then nocturnal enuresis. Okay, nocturnal, the word itself, sleep. Okay, so the discharge of urine during sleep resulting in bedwetting. Nocturia, that is urinating frequently at night. Polyuria, that is increased amount of urination or excessive urine production. Hematuria, so blood in urine. Alkaptonuria, that is black, also known as black urine disease, that is a urine turns black when exposed to air. It's a kind of genetic disorder that prevents the body fully breaking down two protein building blocks, that is amino acids called tyrosine and phenylalanine. Next one is polycystic kidney disease. It is one of the most common inherited disorders. In polycystic kidney disease, the kidney tubules become riddled with hundreds or thousands of cysts. Cysts is nothing but the fluid-filled cavities. Then the next one is renal calculi or otherwise known as nephrolith. It is nothing but kidney stones, that is the crystals of salts present in urine occasionally precipitate and solidify into insoluble stones called renal calculi or kidney stones. Hydronephrosis. Hydronephrosis is a condition of fluid retention in the kidney. Hydro means water, nephros means kidney, osis means condition. Okay, so swelling of the kidney due to dilation of the renal pelvis and calyces as a result of an obstruction to the flow of urine. It may be due to a congenital abnormality, a narrowing of the ureter, a kidney stone or an enlarged prostate. Then hydroureter. It is nothing but the fluid retention within the ureters. Cystitis. Anything that ends in itis means some inflammation. Okay, so cystitis means inflammation of the urinary bladder. Then urinary tract infections, that is infection of a part of the urinary system or the presence of large numbers of microbes in the urine. Glomerulonephritis. So itis, I have already mentioned, it is nothing but the inflammation. So glomerulonephritis means inflammation of the kidney that involves the glomeruli. The nephrotic syndrome. It is a condition characterized by proteinuria, that is protein in the urine, and hyperlipidemia, that is high blood levels of cholesterol, phospholipids and triglycerides. Then renal failure. That is the kidneys lose the ability to remove waste and balance fluids. So renal failure can be further categorized into two, that is acute renal failure and chronic renal failure. In acute renal failure, that is ARF, the kidneys abruptly stop working entirely or almost entirely. Then CRF or chronic renal failure refers to a progressive and usually irreversible decline in glomerular filtration rate. Azotemia. It is the presence of urea or other nitrogen containing substances in the blood. Then cystocele means is nothing but the bladder prolapse. Occurs when the bladder descends into the vagina. Then diabetic kidney disease, a disorder caused by diabetes mellitus in which glomeruli are damaged. The result is a leakage of proteins into the urine and a reduction in the ability of the kidney to remove water and the waste. Dysuria means painful urination. Then stricture. It is narrowing of the lumen of a canal or hollow organ as may occur in the ureter, urethra or any other tubular structure in the body. Then uremia, which means the toxic levels of urea in the blood resulting from severe malfunction of the kidneys. Urinary retention, a failure to completely or normally void urine, may be due to an obstruction in the urethra or neck of the urinary bladder. In men, an enlarged prostate may constrict the urethra and cause urinary retention. If urinary retention is prolonged, a catheter is a slender rubber drainage tube. So if the urinary retention is prolonged, a catheter must be placed into the urethra to drain the urine. So here you can see some of the procedures that comes under the urinary system. So cystoscopy. Scopy means it is a kind of scope to visualize or to examine. So the cystoscope is mainly used for direct examination of mucosa of the urethra and urinary bladder and prostate in males. So in this procedure, a cystoscope, it is a flexible narrow tube with light. A cystoscope is inserted into the urethra to examine the structures through which it passes. So it is a device or it is a procedure in order to examine the mucosa of the urethra as well as urinary bladder and prostate in males. Then dialysis. So dialysis is a treatment method, okay, usually done when the kidney doesn't work properly, thereby accumulation of impurities occur within the blood. Mainly of two types, that is hemodialysis and peritoneal dialysis. In hemodialysis, where the blood is circulated through a machine which acts like kidney, thereby removing the impurities, and then the clean blood is returned back to the body. So this is about the hemodialysis. Then peritoneal dialysis means here, a clear fluid is injected into the peritoneal cavity. The impurities get diffused into the clear fluid and after a certain time the fluid is aspirated back. Okay, so this is the difference between hemodialysis and peritoneal dialysis. Next method is or next procedure is ESWL, that is extracorporeal shock wave lithotripsy. This method or this procedure is usually done to break down and remove large kidney stones and other stones in the urinary tract. Here, high frequency shock waves are used in this process. Then renal biopsy, okay, that you already know. A small portion is used to examine, okay, any other abnormalities or anything is present. So a small portion of the kidney or whatever organ in the urinary system, a small portion has been taken to examine. Then renal transplantation. Here, transfer of a kidney from a donor to a recipient whose kidneys no longer function. So in the procedure, the donor kidney is placed in the pelvis of the recipient through an abdominal incision. During a kidney transplant, the patient receives only one donor kidney since only one kidney is needed to maintain sufficient renal function. Then urinary catheterization. It is nothing but it is a procedure to drain the bladder. Okay, so we have completed the anatomy and physiology as well as some of the abnormalities related to the urinary system and some of the procedures as well as the diagnostic method. So we have completed this chapter. If you have any doubts, you can mention in the comment section. Thank you everyone for watching this video. Please like, share and subscribe. Have a great day.